Hey friends, welcome to my channel, Life with Everyday Haley. And in this video, I'm going to give you a fertility update on our fertility care and our journey and some things we've learned through additional testing. If you're new to my channel, welcome. Here we are going through my fertility journey of recurrent pregnancy loss testing and how we move forward. So if you're in this boat with me, my heart is with you. I understand, I empathize with you, and I pray for success for us someday in the future. So in my previous video, I talked about my first fertility appointment, meeting my doctor, talking about a care plan and how we move forward. And in this video is a follow-up to that. So since I met with my physician, we waited until my next cycle after my loss to do some additional testing. So we did an ultrasound for follicle count that turned out great. We did some additional blood work, cycle blood work. And so I was tested for testosterone levels. I was tested for prolactin. I was tested for like 17 hyperprogesterone or something like that. I was tested for estrogen levels, I believe, AMH, so that would be like egg count, FSH, LH, those types of things. So all of the basic cycle hormone blood work. Also everything, she tested me on several things on my thyroid that came back fine. So I'm happy to report that a lot of my blood work came back very, very good. Oh yeah, she also tested me on like DHEA. And so again, I am a patient that is suspected to have PCOS. And so we were going through testing to try to figure out like what kind of PCOS I have, what's causing my losses and things like that. And I would like to say that I'm still kind of confused about my journey. I have questions. I don't really understand. But again, bodies can do weird things, and it could be that I just have a mild form of PCOS. So let me break it down, and if you relate or understand or have a similar situation, please comment below. We can talk about it. All blood work came back really good, even testosterone levels, and my insulin was high. And so we're leaning toward, insulin resistance, PCOS. My ultrasound showed polycystic ovaries. I have the acne, I have the facial hair, I have the PCOS symptoms. But like I have hypoandrogen symptoms, but my blood work looks really good. I will say that when I came off of the pill, I'd shared this before, I had a lot of cycle issues, which felt like my hormones were not balanced. Maybe they have finally rebalanced. I don't know. And I did get put on metformin for my insulin resistance, so that was shared in my last video as well. They want me to be on 1,500 a day of metformin milligrams, which I am trying to work myself up to that amount. So for blood work, everything looked really good except for my AMH level was too high. That can be a sign of having PCOS, having too many eggs produced, I guess you could say it that way. And my ultrasound did confirm too many follicles. So she's like, this is very consistent with PCOS diagnosis. For my age of 30, I should have an egg count no higher than like 11. Mine is over 14. So it's not terribly high, but it is higher than it maybe should be. So it's kind of a red flag, like, okay, something's going on with her. Very weird that my hormones are pretty good. I mean, I've always had normal ovulations and normal cycles, so maybe that is why. Also, my FSH and LH ranges were great, very normal, and I know with PCOS, those can be off. So she still basically was like, I think you have PCOS, but again, blood work looks pretty good. So it's so weird. And I will say this, I was diagnosed with PCOS based on hormone level issues. So again, maybe with God's grace, everything is balancing out right now. I know PCOS can kind of go in waves in your life and you can have flare-ups. Again, I've been on metformin for like a month and a half, so I don't know if that is helping things. And then I've been on tons of supplements with my new lifestyle change plan. So if you're a person that can identify with maybe having normal cycles and also PCOS, please let me know. I'm kind of confused by all of it. But that is the only thing in my blood work that shows up as a problem, like the only thing. And so like nothing else shows up. I'm negative for all clotting disorders. I'm negative for my chromosome karyotype just came back as good. Like I don't have a karyotype problem. We don't have any genetic matches in passing something down. You know, like based on our genes. I haven't had my progesterone tested or anything like that. But I asked for that to be tested at the end of my cycle. So I'm going to hopefully get that tested in a couple days at the end of my cycle. Usually when I do have issues in my cycle, it's after ovulation and that like a PMS period of just a lot of cramping issues. And so I've just wondered what's going on. I did ask her about endometriosis. However, I don't really have signs of endometriosis. I know there's something called silent endometriosis, so maybe I should look more into that. But the only symptom that I would have that would remotely identify with endometriosis is bad cramping before my period starts. Like that's it. I don't have any other signs. And if you have any advice on that, let me know. 2 other tests that she recommended we do, which we just did today, and I'm going to post a video on my channel about these. I did the saline sonogram and the endometrial biopsy today. So those 2, that video will go on my channel shortly with how that went. The endometrial biopsy is a test that's very, very feared in the female community. I got through it. I'll say that I got through it. So make sure you tune into that video. So for next steps, I feel like we really exhausted a lot of recurrent pregnancy loss testing at this point. Like I have done most everything I can think to do. But all of our blood work looks great. Like I've learned so much about my body. And my husband had a semen analysis, which that was a whole funny experience. Well, it wasn't funny, but awkward would be the word. But his results came back phenomenal. So, okay, as we move forward, I think the theory with PCOS is a couple things. Maybe my body's not producing a really good quality egg. And so the idea is to take letrozole to have like a super ovulation and potentially, you know, have a medicated cycle and then potentially have a better egg produced that can fertilize and implant better. I'm willing to try that with the fertility doctor. And I've actually talked to 2 fertility doctors. One was like, I don't think you need that. You get pregnant easily anyway. And you ovulate, so we don't need to put you on that. The one that I'm currently with is like, let's try it. I think I'm willing to try it to see what happens. I mean, I don't think it could harm anything, but if it is gonna give me a chance to have a better egg produced that can be like a mature like a really good follicle that turns into an egg, I'm willing to try that. And then we've also talked about, so after I ovulate a certain day of the cycle, I would start taking prometrium progesterone supplements vaginally 2 to 3 times a day. Depending on my levels, they'd monitor my blood work, they'd monitor my levels once I get a positive test, you know, make sure hormones are good, make sure beta's rising. And I believe women with PCOS specifically and autoimmune issues can have issues with progesterone levels in pregnancy. So was that my problem with my last pregnancy? I don't know. I never had my progesterone tested in my last pregnancy. And I actually didn't even have my HCG tested when I found out the baby had did not have a heartbeat. I wasn't able to get my HCG levels tested. So that is why I am at a fertility clinic, because I was like, I need more care. I want to know what's going on in my body. And so if you're someone that's had several losses and you're like, I need help, like next time, like I don't want to be left out to dangle, go see a specialist that will take more time to care about you. So she will monitor me very early. I don't know all the details of that yet, but I will not show up at my 8.5-week ultrasound like that again. Like that will not happen to me again. If there is an early development problem, I think we'll know about it sooner, which that still would just suck. But at least like being monitored so early, I would feel a little bit more support and I wouldn't just be surprised, because I can just say that like showing up thinking that everything was fine and it was not, was horrendous. And again, that was 2 months ago, so I've had time to process my loss, accept my loss, and move forward. So, and also another thing is start baby aspirin the same day that I would start the Prometrium. So baby aspirin, it can help some underlying blood clotting issues if there's anything going on, just help blood supply. So it's really weird, some of the protocols that they've come up with. There's a lot of different protocols for recurrent pregnancy loss that people try, and we'll see if it works. I don't know if it's gonna work. I think I've told my husband, if we have another loss, I think I will go to a reproductive immunologist, which is someone that focuses on, recurrent loss if you do have an autoimmune disease. And I do have an autoimmune disease. As of right now, my RA doctor is like, you're in remission. You're on high level arthritis medication that is safe for pregnancy called Cimzia. And I don't think your RA is contributing to your losses. He's told me that flat out several times. And I just had several additional blood work panels done with him. So I'm kind of looking into like what my body's doing with inflammation right now. And we haven't tested my husband's karyotype yet either. We tested mine, but we haven't tested his. And so we're just kind of debating right now, do we go ahead and do his karyotype, or do we just stay with mine? His insurance plan is not as good as mine, and it can be kind of pricey for that testing. So we're kind of debating. It's just the fact that mine was normal, and you only have like a 5% chance of that even being a reason for your pregnancy losses. So we feel like his will be normal too. We could totally be wrong and be stupid for not testing it right away, but we're kind of debating that right now. And like, so anyways, those are the next steps. I'm gonna definitely wait for my biopsy to come back, and then we may move forward with trying some medicated cycles. I've gotten my cycles back. I'm ovulating again. So that's my update for you. If you have any questions, please feel free to leave them in the comment box below. We'll chat about it. And I thank you for tuning into my update. So if you are on this journey with me, my thoughts and prayers are with you. I wish you the best of luck. And we are in this together. Remember to advocate for yourself and just keep praying for your miracle baby. And thank you for watching my channel. I'll see y'all next time. Have a great day.